What is the advantage of this technique? Compared to classical stiff umbilical catheters, the silicone catheter duration is much longer and the risk of thrombosis is decreased. Compared to percutaneously inserted catheters, the umbilical insertion of silicone catheters is painless, easy, and the risk of catheter section disappears with the metallic part of the introducer being blunt. Furthermore, it has a sparing effect on peripheral veins and is very comfortable for the baby who can move freely. How long can the silicone catheter be maintained? The catheter duration is exactly the same as the percutaneously inserted silicone catheter. It can stay for several weeks. Removal due to catheter-related sepsis is exceptional and similar to the percutaneous route. Is there any adverse effect in maintaining the Orantius duct open? Every baby who receives an umbilical catheter has an echograph to check for abdominal complications before discharge. We have observed a few cases of hepatic calcifications without clinical implications. What is the catheter maintenance technique? It's identical to the percutaneously inserted catheter. No routine dressing changes are necessary, only in case of local complications, such as bleeding or catheter twisting. What are the contraindications or exclusion criteria? They're the same as for the insertion of a classical umbilical venous catheter, like abdominal surgery. When is the catheter inserted? Usually in the hours following birth when the baby is in a stable condition. Meanwhile, a peripheral line is used. In emergency situations, a classical umbilical catheter might be preferred depending on the skills of the physician. The introducer can be used when the classical catheter is removed. This is a rare condition. What type of equipment is needed? The usual equipment for umbilical venous catheterization and a smooth forceps for indwelling the catheter through the introducer. Are there birth weight limitations? No, any baby who can be catheterized with a 6FR umbilical line is a potential candidate, from 500 grams up to more than 4 kilos. Why do you propose 3 different lengths for the introducer? According to the appropriate catheter insertion distance, it's convenient to choose the shortest introducer. Is there any risk of air embolism? No, the introducer is flushed with saline and the proximal 19G lumen filled with the silicone catheter before insertion. Why do you clamp the introducer filled with the catheter during insertion? It keeps the catheter in place. How do you check the positioning? By regular X-rays after placement, later on by echocardiography. The catheter tip must be in the inferior vena cava at the entrance to the heart. What to do in case of malposition, portal vein? The catheter is removed and the percutaneous route is chosen. What does the umbilical stump look like when the catheter is removed? Slightly humid. Is there any resistance when the catheter is removed? No, removal is easy. What precautions should be taken before removing the catheter? Although exceptional, the presence of thrombosis is verified by echocardiography before removal.